Hi everyone, this is Alamjeet Flora, founder of Pothos Events. Welcome to the Wednesday Talk Show. The Wednesday Talk Show is brought to you every Wednesday at 6 o'clock Sweden time and at 10:30 India time. So welcome once again to the show, and we are very glad that we are completing this whole year of over 50 episodes that we have done with various experts who've been on this platform. We've touched upon as many topics as mental health, mindset, meditation, and many more deep topics that you can go and also view our episodes if you want to. Hello to all our new viewers. Welcome today. We are going to be talking about skin, hair, and nail care. So, we have seen everyone, we are constantly in this dilemma of the weather changing and thus affect our hair, our face, our skin. So, there's always an issue that we're dealing with, and we are finding solutions all the time. And these things, these aspects of skin, hair, and nails always enhance our looks. You will see every socialite, every film star being very careful and conscious about how their hair, makeup, everything is. So this plays a major role in your confidence as well. So today we have with us Dr. Sangeeta Kamboj. She's joining us from India. She is a dermatologist and also a hair transplant specialist. She has been working since 10 years in this field, and she also does lots of procedures, which we'll talk about now shortly. So please, guys, welcome Sangeeta on board.
Hello,
Welcome,
everybody.
Sangeeta. Hi. Welcome to the Wednesday Talk Show. Very glad to have you on a platform.
Thank you so much, Alamjeet. I'm so glad to be here, and I'll help with any questions, any queries that are there, and also answer your questions as well.
Yeah, we have largely people joining on this platform from Nordics. So we are a cold country. So you can
Yes,
imagine the issues that
yes,
we may have.
yes.
But before we take on that road of giving so much information to our people, guys, please
Yeah.
do ask your questions. They're going to be so helpful. Also, Sagita, please do introduce yourself and tell our viewers what you do, what's the field of expertise you have.
All right. So, hello everyone. I am an MD in dermatology. I also look after hair and hair diseases, hair care overall, and also nail care and nail diseases. I am a hair transplant specialist, so I also look after bald patches. And Yes, I also look after hair diseases.
Um,
Can you
yeah,
hear me? Sorry.
yeah, there was a slight
So,
pause, but fine, carry
yes,
on.
yes.
No,
Sorry about that.
no problem.
So, overall, we deal with skin and cosmetics side by side.
Mhm. Very nice. Thank you so much. We already have a good compliment coming from Disha for you is that you have lovely, beautiful hair, Sangeeta.
Oh, thank you.
Yeah, that's a good
Thank you so much.
start. Yeah, so guys, like everyone has a lot of skin problems. Like now, I'm going to be talking about not just women and all, but even men, teenagers. We are dealing with a lot of skin issues. So, what
Right.
do you think is the reason behind it?
So, skin as such, I can say, is the largest organ of our body. To take care, because I feel that it is like a armor that protects our internal organs.
Yeah.
Um, it is like the soldiers who go on war, they have their protective shields. So this our skin is like a shield. It protects against various pathogens, it protects against various germs that is attacking on our skin. It can be at any level, like a smaller level or a larger level. The skin diseases that happen, essentially it happens due to maybe negligence of or postponing of not taking care of the skin. Maybe there
Yeah.
was a smaller problem before and then became larger over a period of time. Or there can be a reason, maybe genetically associated or hereditary, going on in the families, that can or cannot be treated. So there are various categories of skin problems, there are various categories of hair problems, that can be dealt with medically, because our technology has advanced so much that we have solutions
Yeah.
for almost each and every diseases that are there. But
Right.
there are certain things like genetically predisposed or hereditary, that may or may not be cured. So there are various reasons. There may be genetically or acquired. So I would say, if it is acquired, if somebody has like a smaller, like a fungal infection, and it gets like, okay, I'll go to the doctor after 2 weeks, or maybe it gets
They-
postponed. So
Yeah.
then it goes on, it carries on, and it spreads throughout the body. So that kind of diseases, then they propagate in such a sense, and then they come to the awareness of the patient, and then the doctor is approached in the end.
Right, right. And this could also be lifestyle related, right? So if you don't have a
Correct.
correct lifestyle,
Correct.
it of course impacts the way.
Yes, so this is seen over here. I mean, at this point of time, I can say since the last 10 years, our lifestyle has changed as such. It has become more sedentary, I would say,
Yeah,
and it has become a lot of including a lot of junk food, um, a shifting of the more less exercise, towards less exercise,
yeah.
physically less active, because we are more on our screen time nowadays. So
Everyone's
all
best.
these
Yeah.
things, yes, all these things have been, they accumulate and then they lead to obesity maybe in children, because I have seen a lot of kids in teenage group between 11 to 15 years, obese kids coming to me,
Oh,
and
yeah.
they have issues because of the obesity, because of the more fat cells, that leads
Mhm.
to hormonal issues, and those hormonal issues then reflect on the skin in
Skin.
terms of acne, in terms of pigmentation, in terms of hair growth, where unnatural hair growth, basically, especially in girls.
Yeah, because
So,
of the hormones.
yes, yes, yes.
Okay, okay. We have a question. I'll take it.
Yeah.
Is it safe to do hair transplant?
Absolutely, absolutely. So, hair transplant, see, I'll explain in a very simple manner that it's nothing but filling up the bald patch. So,
Yeah.
first we decide which bald patch we have to fill up, whether it's in front or top or behind. And then, basically, the behind part of our head, which has hair, that strip of hair is the donor area. Donor meaning we extract hair from behind and we
Oh,
implant it on the bald patch, which is
okay.
done at the same time.
Okay.
So this is extraction, this is implantation, and it is done under local anesthesia. So the
Patient
person
doesn't get the
is
full
not
treatment.
sleeping. It's just
Hmm.
the locally on that skin we give anesthesia. It's injectable and it's like practically painless because we use very thin needles.
Okay.
So it is easier said than done, but it is easier than going under general anesthesia. So this is a OPD procedure.
Okay.
It's you come in, do your hair transplant, and you step out of the clinic. It's like that.
Okay. And the Disha is asking how long does it stay?
The hair transplant, the hair stays forever because this is your own hair, and
Okay.
this area is independent of any kind of influence from the body, like you can say nutritional deficiencies, hormonal issues, people who are
Yeah.
having hormonal issues and have lost hair from here. So
Yeah,
this is
usually
independent.
you see this part
Exactly.
going first. Yeah.
So this part is independent of any kind of hormonal issues or any kind of nutrition deficiency. So once you implant your hair, it is going to stay there for your lifetime.
Okay.
So you, after hair transplant, you have to take care for a year or two, that the post procedure we explain it to the person, that, and it's not that hard to follow. It's very easy, and
Mhm.
yeah, and a lot of people are doing going on for hair transplant now.
Okay. Now
Yeah.
I have little knowledge, so I'm going to ask you maybe a silly question.
Yeah.
Is that does the hair grow like normal after the transplant is
Of
done?
course,
Or
it is your
okay.
own hair. Yeah.
Mhm.
So not only men,
The
actually,
growth
women
is
also grow.
natural, like if you cut it, it
Yes.
grows again. Oh,
Yes. So even if I have to go for a hair transplant, so women also
yes,
they do hair transplant.
yes, yes.
So whatever hair we have extracted, we implant the same hair, and it grows as the same hair. Like
Yeah.
it's your natural hair. Yeah. Whether your hair is curvy, whether your hair is frizzy, whether your hair is straight, wavy, it will be
Like
like
that.
that.
Oh,
Yes. Yes.
nice.
Yes.
Good to know. It's a good solution. Very nice.
Yeah.
Uh,
Yeah.
is it very expensive?
It depends.
Okay. Depends on
So
what, like, what are the
it
factors?
depends on clinic to clinic, or maybe the company that you are doing it with. It
Hmm.
depends on that. It depends on there are some clinics, or there are some places where the doctor is not doing the procedure, the assistants or maybe the other person is doing the procedure.
Yeah.
So it depends on where you're doing also. Suppose if you're doing the same procedure in India and the same procedure maybe in London, so the
Hmm.
price difference will be,
Prices, yeah, will
yeah,
vary. Yeah.
although it will be like 100 rupees per hair over here, so you can calculate the same thing in
Okay.
UK, yeah, UK pound. So
Okay.
it's like that. So that is, some people say it's expensive, but some people say it's reasonable. It's like that.
Now you take it 100 rupee figure per hair. Now, every hair loss is going to feel like $1 million.
Yeah,
Okay.
totally, totally.
Great. So, Sangeeta, and how many sittings do you need for this hair
For the
transplant?
hair
Is it
transplant,
done
it's
in
one
one sitting?
one sitting, one
One
sitting.
sitting.
So see,
Okay.
it depends on the number of hair. So suppose in one sitting we do maximum 4,000 hair, because it takes about 6 to 7 hours
Okay.
with break, with a break that we take in the middle.
Mm-hmm.
It takes about 6 to 7 hours. Now after that, you know what, we do not extend it. We can
Uh-huh.
do 6,000 hair, we can do 7,000 hair, but we do it over a period of 2 days if required. But if
Okay.
it is a small patch, if it is 3,000 hair or 4,000, it can be done in a day. So in and out procedure.
Okay. Now,
Yeah,
I also want to ask you a question is like very often people, of course, are getting bald, they get
yeah,
conscious.
yeah.
But is there, other than before, going into a hair
Correct,
transplant thing,
correct,
is there
correct.
something like an oil? You hear of so many oils that can bring back that
Yes,
hair.
yes,
So
yes.
are those effective? Like,
So,
is-
see, it depends on which stage the hair loss is. So,
okay,
suppose there is a person who is coming at a very initial stage where only this hair is gone, only the frontal hair is gone. So,
yeah,
in that person, I would not suggest hair transplant. I would always suggest non invasive procedures like, PRPs. So, PRPs are platelet rich plasma. So that
okay,
is also a very easy procedure in and out. There we take your own blood, we centrifuge, we separate the plasma, and we
mhm,
inject it on the bald patches. So
okay,
in that sense, what we are doing is we are injecting your own growth factors, because the plasma that is extracted has a lot of, like, thousands of growth factors from your own body, and you're
okay,
injecting it around your hair roots where the hair loss is happening. It is
mhm,
an ongoing process. So what we are doing is we are strengthening the hair root, which is creating the hair loss. So once we are doing that, the hair loss, I'm not saying it will stop eventually, but it will halt or it will get delayed. So
yeah,
the bald patch which is there, which was progressive,
mhm,
maybe it may get delayed over a period of 5 years or over a period of 10 years. So he can delay the hair transplant for another 5 years, maybe. So
okay,
this PRP, I always suggest that,
mhm,
people who have not yet gotten to that, the whole bald stage
yeah,
thing, they can go in for PRPs. Women, especially, with lot of hair fall, with
mhm,
certain hair thinning on the top of the scalp, they
right,
can go in for PRPs, because women, I have seen that they have better results than men in PRP, in terms of PRPs.
okay,
Yeah, yeah. And then
that's,
there are other procedures like meso treatment also. So
mhm,
meso is also, it's like a liquid solution which is prepared, pre-prepared. Okay. And
okay,
then we just take it in a syringe and we inject it around your hair roots. So those
mhm,
are artificial growth factors which has been prepared already in the laboratory. And it has been given to us and we inject it. Whereas PRP is a natural form where we take it out from your own body.
okay,
So
and I think
that's
we will decide this case to case. So
exactly,
it's
exactly.
suggested differently. Okay, good. And what I would, we'll come back to skin now.
Yeah,
We just listened to
a
the
lot
hair.
about.
Yeah. So we'll come back to little skin. And I really want you to suggest to all our viewers, and
Yeah.
especially considering also that, we are from a very cold country. It's like
Yeah.
-6 or -7 right now. It's all snow here.
Yes.
And in summers, this heat is really scorching, it's like
I'm sure.
really piercing. So we live
Yes.
in these climates. So what would
Correct.
you suggest for, like, of course for everyone, but also for
Right.
our country, people this side of
Okay.
world? So
So
a
there are
good hair
two,
routine.
yeah, what I would think is there are two essential things that I would suggest. One is sunscreen
Mhm.
and one is moisturizer. So
Oh,
why I would say sunscreen is because you are surrounded by snow, and
mhm.
the snow reflection, the the ultraviolet A rays and the ultraviolet B rays that are reflected from the sun, it
Right.
gets highly reflected from the snow to our skin and
Yes.
also to our eyes. Okay,
Yes.
so
Yes.
you see the glares everybody wears, but what about the sunscreen to protect our skin? Especially so if you're clothed everywhere, the face is still exposed. So I would say that broad spectrum
Mm.
medicated sunscreen which has both protection like UVA protection and UVB protection, and that would be recommended by your dermatologist only, because what you get over the counter like like Lakme products or
Yeah.
any other cosmetic products may or may not have these protections, okay, may or may not have these ingredients. But
Okay.
a broad spectrum sunscreen would be
Mm.
ideal for that kind of scenario.
Yeah.
And moisturizer I would suggest, because obviously there is less humidity, there is more dryness in the air, so it sucks out all the moisture from the skin. So
Mm.
especially at bedtime and after bath time is the ideal time to use a moisturizer. So moisturizer should contain all the butters like shea butter, mango butter. There are a lot of like urea less than 10%,
Yeah.
PEG, polyethyl glycanol. All these ingredients are essential ingredients for the moisturizer, and it'll really help the skin because skin needs that kind of water to retain.
Yes.
Otherwise, what will happen if you don't use a moisturizer? The skin becomes dry and then it becomes itchy. And
Yes.
once it becomes itchy, it gives rise to various problems like, allergies or eczemas. So
Yeah.
just to prevent that, you can use it on a daily basis.
Yeah, I think here, and it's very interesting that you mentioned that we have to use, the sunscreen even in cold weather. So this is
Absolutely.
a point to
Absolutely.
be noted, like, because we
Yes.
normally think about a good moisturizer. Of course, we
Right.
moisturize ourselves very well because we have to do it.
Right.
But good that even the sunscreen is good for our skin, and it's
Right.
and the night routine. You're saying in the night we use the moisturizer, right?
Moisturizers can be used essentially at night, because night when we go to sleep, it is the healing time. So
Yeah.
everything is at break, like our mind is relaxed, even our skin is relaxed. So once the skin is relaxed, moisturizers work the best, and it has been experimented, it has been put in the data, it is scientifically proved that moisturizers at night is the best to use. And
Good.
sunscreens, I would say that that is also in the data if somebody wants to just research about it, that the reflection from the snow is 95% more than other surfaces. So
Yes.
all the more reason to use a sunscreen.
Right. Yeah, of course, we feel that. We experience that quite a lot. Like if we don't
Right.
wear our glares in the snow, it's very difficult to walk around.
Yeah. Yeah.
Yeah, it is, it is. And what do you say about the nutrition that we should have for our
uh,
skin?
So nutrition, I would say it should be a balanced diet.
Mhm.
More of fruits in the sense whichever fruit is available seasonally.
Yeah.
One fruit a day would really nourish in terms
Mhm.
of your body, systemically also, and skin health wise also.
Okay.
So fruits containing vitamin A, all the yellow colored fruits have vitamin A, which
Yeah.
is essential. All the citrus fruits have vitamin C, which is very good for our elasticity of our skin.
Mhm.
So any one fruit which is available season wise
Yeah.
would be as advisable. And vegetables also, I always stress on green vegetables. So whatever green vegetable is available, at least in your plate, one green vegetable should be included. It has a lot of antioxidants. So antioxidants basically are products which cancel our toxins in our body. Okay, so the toxins, if they accumulate, they create premature aging. The fine lines and wrinkles, they happen before the age of 40. So that is
Right.
premature aging. So we can prevent that by having a lot of antioxidants. So green vegetables, the colored bell peppers, the green, yellow, red bell peppers, broccoli, green tea.
Yeah.
Consumption of these would help the more of antioxidants to be generated in our body, and then they prevent premature aging.
Yeah, that's interesting. I had a question on this for you. Like,
Yeah.
what do you think about, of course, these treatments is like Botox, about
Yes.
laser treatments, and
Yes.
also about anti-aging creams, and all lot of
Right.
solutions coming for
Right.
anti-aging also. So, what is your take on these things?
So, anti-aging cream, I would always recommend if somebody is looking for it, look for retinol.
Right.
The ingredient retinol is important as an anti-aging ingredient, because medicated anti-aging creams, they have 1% retinol, which is the essential, and the other essential ingredient is hyaluronic acid, which maintains again the elasticity of the skin. So these two ingredients are important. I'm not sure whether they are cosmetically, included in the products or not, but medicated creams, we have a lot of products like that. So
Okay.
we generally prescribe after the age of 35 at night daily application. So that prevents as an anti-aging product as a daily application. So that is one thing. Secondly, coming to laser and Botox. So, Botox is again an anti aging procedure.
Hmm.
It has to be repeated every 4 to 6 months.
Yeah.
And the other thing is, people always ask me whether it is safe. It is
Yeah.
absolutely safe because we are not injecting anything systemically, it is only going into your muscles. So, basically we do Botox for our upper face or
Yeah.
lower face. So you see these dynamic lines. When we frown, we have these dynamic lines. Okay, so
Yeah.
we inject Botox on these muscles which create the frown, or the muscles which create our crow's feet, the lines which come around our eyes.
Yeah.
Okay, so those muscles, they get relaxed. So Botox is nothing but a protein that relaxes the muscle, and
Okay.
that too, to create the effect of a relaxation, so that when you frown, these deeper lines do not come. Just a thin frown line will be there, so it looks natural, but it doesn't create that, the plastic effect that you
Yeah,
may
it
see
should be.
sometimes.
Yeah, it should be. If it's not well done, I don't know. I have seen people with
Yes,
really bad Botox.
yes,
And
yes, yes.
what age group do you think like should do Botox? Because you see everyone doing it. Like there is no
Yeah, yeah,
age
yeah.
group, but
So, people who are on screen, they would be doing it, but
yeah,
normally we would say after 40. After
mhm,
40, what happens, the skin actually normally also it starts sagging. We
yeah,
have more deeper lines coming when we are having emotions. So
right,
that is an ideal age to start doing a Botox.
okay,
But the only thing over here to remember is it should be repeated every 4 to 6 months. I'm not saying that it should be maybe 100%. If a person doesn't want to do it, it's fine.
yeah,
But if you keep on repeating it, then you will be maintaining that look for a longer time and
hmm,
without having any side effects.
okay. But
Yeah.
you're saying every 4 to 6 months, but then after the effect is gone, the skin again sags.
No, 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 no.
No,
That doesn't happen. No, that's the positive point of doing Botox is, suppose we started with a level A. So this is a deeper line that we start. So after 6 months, the deeper line will not be there. It has gone to level B. So we have to start from the level B and not from the level A. So the
okay,
deeper lines has become less deeper. It will
mhm,
be like that. And
okay,
then we are treating only that less deeper line. Okay,
okay,
and then it becomes better. It comes to level C, which is higher than level A.
okay.
Yeah.
All right. Oh my God. Now I'm having more questions popping up in my head.
It's okay, throw
Interesting.
through.
Interesting. And what do you say about these laser treatments, especially for like hair? We
Right,
had
right.
discussed in the holistic life as well
Yes,
about
yes,
laser treatment, and you said it works. Can
right.
you elaborate here also
Sure.
how it works? Yeah.
So basically, this is called laser hair reduction.
Hmm.
The age group to be done is after 15 years of age, anybody can do it,
Yeah.
because we have lasers which are absolutely safe. There are no side effects. And laser hair reduction can be done at any body part. Any body part can be treated. Arms, forearms, underarms, belly buttons, and thighs and legs. Anything can be treated. Now, why I say laser hair reduction? Because it reduces the number of hair. It changes the quality of hair. Suppose you have like thick, dark hair on your legs, underarms, which has that property of growing that kind of hair.
Yes.
Once the laser light comes, it becomes lesser after like a few sessions. The
Hmm.
hair becomes thinner and lesser density. So suppose if you started with 100 hair, in the end you will be left with about 5 to 10 hair.
Yeah.
And also the hair will be so thin that you can manage it by yourself. You can just shave it
Yeah.
off, or you can just
Right.
wax it off. It'll be easier than
Okay.
doing the whole process of waxing for your whole body part. So
Okay.
laser hair reduction, like hair transplant, has come in vogue since the last 10 years.
Yeah.
And, especially the teenagers, after 15 years of age, they are so conscious about,
Yes.
the hair growth. So,
Yes.
and it's absolutely safe. There's nothing wrong in that,
Hmm.
especially the face. The face also, upper lip, chin, side locks, anything can be done. And
Okay.
it gives result. The hair is like, the so much of hair and only one or two hair is left behind. So you
Yeah,
can
that's
definitely manage it.
yeah, that's brilliant.
Yeah,
That's a good relief for people, especially who have too much hair. It,
exactly.
it's like a good solution. Yeah, and we also discussed that people with hormone changes and
Exactly.
PCOD or
Yes.
may have a little
Yeah.
slow, uh, I mean slow results showing.
Show results. Yes, yes. So, especially women with PCOD, with the imbalance of the hormones,
Yeah,
there we have found that instead of, suppose in a normal person we do 6 sessions, in that the person with PCOD we might need 10 sessions or 12 sessions.
yeah,
But still, the hair growth might be coming back along with the hormonal imbalance. So, on the side, we also recommend that please have a gynec consultation to control your hormones, and then do the laser session for your hair. So, both are controlled
and
automatically and simultaneously.
right, right. We have a question coming from Deepika.
Right.
She's asking, can alopecia be treated?
Yes, but can you tell me which alopecia are you talking about? See, alopecia is different types. So
Hmm.
one is alopecia areata, which is autoimmune. Autoimmune meaning, suppose the hair root is there and it is bombarded or killed or inactivated by our own antibodies. We
Yeah.
have a lot of antibodies, so our own antibodies are killing or affecting our hair roots. So that is an autoimmune condition. Now, in alopecia, if she means alopecia areata,
Mhm.
which is resulting in bald patches like all over the scalp, it is absolutely treatable, 100% treatable.
Okay.
But it may recur at any point of time. It is generally associated with thyroid issues. It is associated with diabetes, and also people who have other hormonal issues like PCOD also we have seen,
Hmm. Yeah.
vitamin B12 irregularities. So all these things need to be ruled out
Yeah.
if somebody is having this alopecia areata. Okay. And
Okay.
alopecia is, actually, the definition is hair loss. So hair loss is like many different kinds of hair loss. There can
Yeah.
be hair fall, there can be hair thinning, and there can be alopecia areata that I spoke about right now.
Correct. And even the water, changes, so you lose a lot of hair. Like I can tell you,
Absolutely.
many of we Indians have faced this problem after coming to Sweden. We've
Yes,
lost
I
a lot of
agree.
hair, so you just
So
that
that
also.
is a mechanical damage to the hair and the hair roots, basically, which you can't prevent. Actually, you have to wash your hair. You have to use the water. So all you
Okay.
can do is just take care of your hair by oiling your hair
Okay.
regularly, yeah, giving it more moisture in terms of just a daily care routine.
All right. Good. Deepika has just clarified. She said patches on scalp.
Yes, so that is alopecia areata I was talking about, and
Hmm.
that is absolutely curable. But the only thing is, you need to investigate why is this happening. Is
Yeah.
there a genetic issue, or is there a hereditary issue which is passing on from family, from grandparents to the child? So one is that factor. The other thing, other investigations has to be done to see why is it happening. And
Mm-hmm.
Once it is absolutely treatable. It is like reversible condition. The hair comes back once the treatment is done. But the only thing is it can recur at any point of time. We don't know the triggering factor, but it can recur.
All right. Good. Thank you, Dr. Sangeeta. And we'll go to nails now. So
Yes.
we have a very, we women, even men now I see, we love
Yes,
doing manicures and pedicures.
yes, yes, yes.
So but what's your take on that?
So manicure and pedicure, um, I don't recommend it personally, but okay, it is like, how you have a massage and a facial once a month.
Hmm.
You can do manicure and pedicure once a month. The only thing you should take care is that the cuticles should not be damaged. Everybody knows what cuticles are, because whoever is going for manicure pedicure, they are said that okay, we are doing your cuticles and we are doing this.
Yeah.
So cuticles are important to maintain, because they are the barriers of our nails. Okay, they are like the gates of our nails. The infection enters the nails if the cuticles are not there, and majority of my nail infection patients have had manicures and pedicures before. Like, 90% of people who are coming with nail infections
Oh,
were doing manicures and pedicures. And then what happens, once the infection has come, then it takes long time to get rid of it. That's the only issue over here, because the nail growth is very slow. Our, like, for the fingernails it takes about 6 months, the toenails it takes about 12 months. So even the treatment is like that. For fingernails it takes 3 months for the treatment, and then toenails 6 months. So then it becomes a task
yeah.
in for us also, and for the patient also, to continue the treatment. So
Yeah.
cuticle maintenance is important, and also cleanliness of the nails are also important. Like how in COVID times we have had this awareness of washing
Wash.
our hands regularly. So I
Yeah.
always say that wash your nails also regularly. So you can apply a soap under your nails, and then you can wash your nails, so that the infection, there are bacterial infections, fungal infections, it
Right.
will definitely prevent. This habit will definitely prevent infections.
True, true. Thank you so much. That was a good clarification on on our manicure pedicure thing. So good. Disha also says thank you, and so
Most
does
welcome. Most welcome.
Rita. They both are very happy with your replies.
Most
So,
welcome.
we also have we've suggested very lot of hair removal. Now we have already spoken on that, and Disha has a
Right.
question which has more
Right.
side effects. Like we spoke about the scalp, the receding
Okay.
one. So you spoke about two treatments in that.
Right.
One was the plasma, and the other was
Okay.
yeah.
Meso.
So yeah.
Okay.
So which one has more side effects? I guess Disha,
Um,
this is your question. Yeah.
so, nothing, there are no side effects in both the procedures, because we are injecting right under your skin, near your hair roots. The
Yeah.
only thing you will experience is pain, but that too, we numb the area. So what I do personally in the clinic, and most of the doctors are doing, is we numb from here to here, we give local anesthesia.
Yeah.
So what it does is it numbs the entire scalp for about half an hour, 45 minutes,
Okay.
and then we inject throughout the scalp, whether it is platelet rich plasma, whether it is meso treatment. Okay, so meso treatment is the artificial preparation that I spoke about, and the plasma is from your own body. So
Mhm.
that is a natural form. So
Right.
both are injectable treatment, but the only problem is the pain.
Mhm.
Otherwise, there are absolutely no side effects. See, there
Oh,
will be some kind of heaviness because something has been injected on your,
yeah.
skin.
Yeah.
So the immediate effect is heaviness. But
Mhm.
otherwise, after half an hour, you're absolutely normal. You're just good to go. You can go partying, you can go to your work, you can do whatever you want.
Okay. It sounds like going to a dentist, that
Yeah.
half an hour anesthesia and then you're like sorted out after some time. Thank you. Thank you so much, Dr. Sangeeta. But before you leave us,
Yes.
I would love you to share some of your tips or a message to our viewers.
Okay, okay. So whenever I say that, first of all, three essential things to follow: face wash, for your face, for the health of your facial skin. Sunscreen, as I said, and wherever you are staying, in whichever part of the world, and moisturizer to maintain hydration of your skin. So these three things are the essential skin care tips that I can tell you, and you will maintain your skin for a very long time. And secondly, if you have any skin issues, if you have any skin problems, starting from a small zit on your face to anything like a larger pigmentation or an infection, do not shy away from visiting your dermatologist, because you are helping yourself and you are helping your skin get better. And skin reflects us, skin reflects our being, our emotion. So do not shy away from visiting your dermatologist. So that is my message to all of you.
This fantastic message for everyone.
Yeah, so you stay safe, stay healthy, and we'll have a skintastic future.
Fantastic. I love that word. It's so good. I want it to trend now. So it's really nice. Thank you so much for sharing such
My pleasure.
wonderful tips. And I would love to have you back because I don't think we've just touched upon some
Actually,
small
we have
topics.
many
We have
things to
we
discuss.
have so much to
Absolutely.
discuss. So I would like to bring you back for sure.
Sure. My pleasure. And it was a pleasure talking to all of you. And I hope I've answered all the queries and they are happy.
Yeah, yeah, they are. Don't worry. They'll have more questions and I'll send them
Sure,
across to
sure.
you.
We'll be back. We'll be
Yes,
back.
we will be back for sure. Thank you so much, Dr. Sangeeta. Take care.
Most welcome.
Happy
Take
New
care.
Year and Merry Christmas to you.
Merry Christmas and Happy New Year to you and all of you.
Yeah, thank you
Bye.
so much. Bye bye.
Bye.
Hi guys, I hope you enjoyed today's session. We spoke so much about hair, about your nails, and if you have any more questions, happy to take them on board. So, thank you for joining us today and asking your questions. It's always fun when we have an interactive session. So, thank you, and we wish you a Merry Christmas and a great 2022 ahead. So, see you soon next year. We're going off next week. We will not be there, but we'll see you in the new year. Thank you so much for this beautiful journey of 2021. Thank you, guys. Bye.